Let's learn all about rheumatoid arthritis. Rheumatoid arthritis is a systemic autoimmune disease that primarily targets the lining of the joints and the underlying bone. There is no known cause, and this disease typically follows a pattern of minimal symptoms followed by flares of intense symptoms. People who have this condition may experience painful, warm, and swollen joints. This inflammation is characteristically symmetrical, meaning that it affects the same joint on both sides of the body. These joint symptoms often start in the small joints of the hands and feet and then later spread to the wrists, hips, knees, and ankles. People often experience joint stiffness, especially in the morning and after periods of rest. This joint stiffness can last longer than 45 minutes. In addition to joint symptoms, people may also experience problems with the skin, eyes, lungs, heart, nerve tissue, and even the blood. Risk factors for developing rheumatoid arthritis include being female, being middle-aged, and having a family history, as well as preventable risk factors of smoking, obesity, and periodontal disease, which is a severe gum disease. To diagnose this disorder, your provider may do a physical exam. They may also do blood tests including erythrocyte sedimentation rate, C-reactive protein level, rheumatoid factor, anticyclic citrullinated peptide antibodies, and antinuclear antibodies. They may also do imaging tests like X-ray, MRI, and ultrasounds. You will likely get a referral to a rheumatologist. Some common treatments for rheumatoid arthritis includes physical and occupational therapies, DMARDs, which are your disease-modifying anti-rheumatic drugs, NSAIDs, which are your non-steroidal anti-inflammatory drugs, steroids, biologics, and even surgery. In addition to pharmacological treatment, lifestyle changes like regular gentle exercise, hot and cold applications, stress management, to stop smoking, knowing your limits and being mindful not to overdo it, connecting with others and taking time for yourself can be beneficial in the overall management of the disease. If you have rheumatoid arthritis, some complications you may experience includes osteoporosis, secondary autoimmune conditions like Sjögren's syndrome, rheumatoid nodules, carpal tunnel syndrome, heart and lung problems, and even lymphoma. Let's discuss the difference between two commonly confused arthritises. Rheumatoid arthritis and osteoarthritis are both common arthritic conditions, meaning they affect the joint, and are commonly confused, but they are different conditions. To start, rheumatoid arthritis is an inflammatory condition, whereas osteoarthritis is a degenerative condition. Rheumatoid arthritis is an autoimmune disease, whereas osteoarthritis is referred to as wear and tear arthritis. Rheumatoid arthritis typically has a rapid onset, whereas osteoarthritis typically has a slow onset. Rheumatoid arthritis characteristically affects the same joint on both sides of the body, whereas osteoarthritis affects the most used joints with no regard to symmetrical pattern. Rheumatoid arthritis often has prolonged stiffness in the mornings and after rest, whereas in osteoarthritis, the stiffness occurs after activities. Rheumatoid arthritis typically affects the smaller joints and then later spreads to larger joints, whereas osteoarthritis typically affects the weight-bearing joints. And lastly, rheumatoid arthritis causes finger deformities, and osteoarthritis causes bony enlargements. Both conditions cause significant pain and can have large impacts on quality of life. However, they are very different conditions with different causes and even different treatments. Thank you for learning about rheumatoid arthritis with me.